Every death that occurs from an asbestos exposure could be prevented.
Don't be fooled. There is a connection.
Everything just ties together.
I don't know what I can do.
It's hard to describe what ADAO has been in my life. I certainly can't imagine it without ADAO.
We've come a long way, and I'm really proud of ADAO.
Keep me in your heart for a while.
Next presenter is Paul Zygielbaum, and Paul has been with the ADAO for a long number of years and a very gracious volunteer, I might add. So, Paul?
Thank you. Put that up. Great. Dr. Monforton's talk took me back to 1970, that year that OSHA was put in place. That was the year that I was a sophomore engineering student at Caltech studying propulsion systems and got a job as a technician at JPL, Jet Propulsion Laboratory, and the first task they gave me was to insulate a steel tank that was going to contain cesium and to insulate it with asbestos cloth, which I spent a couple of days crawling around with. It was not, turns out, my first exposure to asbestos, nor was it my last, but it was certainly a significant one, and that was just before the OSHA regulations were put in place. And I don't fault those people, by the way. The people who ordered me to do that didn't know the hazard, just as people today don't know it's still legal. Well, we've seen overwhelming evidence that asbestos poisoning continues to pose a substantial public health risk, and we've heard the toil and lives lost and families broken. In America, this knowledge has not led to a ban on asbestos. As a United States Senator recently asked my wife and me, what happened to compassion in America? It was a rhetorical question asked in some frustration, but I answered her anyway. Compassion does not drive quarterly business results. In past years, I've addressed this conference as a mesothelioma patient opposing continued asbestos poisoning, but I've been a business manager and executive for a long time across several technological industries and in volunteer nonprofit services. So, since compassion is insufficient motivation for America to ban asbestos, I'm here today as a business executive to pose this question. Would there be a positive economic value to prohibiting the presence of asbestos in products in commerce in America? At the outset, I admit that we can't answer this question today, but we can identify important aspects and suggest some paths for further investigation. Consideration of such a question is a very complex task, of course, and must begin with defining exactly whose view of value is to be adopted, that of patients and their families, or businesses, or government agencies, or perhaps the society as a whole. It's my understanding that the value of banning asbestos has never been examined from the national viewpoint in the United States. However, such studies have been done in the past in relation to tobacco use, and it's been suggested to me by an economist who knows the subject matter that similar methodologies might be applicable to the study of asbestos use. I'd like to see that possibility examined by experts. Meanwhile, we'll have to satisfy ourselves with a more cursory look. The choice of appropriate physical methodologies and resulting conclusions are very sensitive to the exact formulation of the economic question posed. An article appeared in a 1997 issue of the New England Journal of Medicine and addressed the potential economic consequences of a complete cessation of tobacco smoking. The authors concluded that overall health care costs would rise in the long run because non-smokers encounter more health care costs over the course of their longer lives. This wonderful insight led me directly to the corollary that health care costs could be eliminated entirely simply by having everyone die right away. So one has to ask a sensible question and ask it very, very carefully. And one has to understand first that what appear as costs to some parties will appear as benefits to others. As a simple example, what this patient sees as a cost of healthcare services appears to her nurse as a source of income. One thing that prompted me to ask this question is my own experience as a patient, so let's begin there. Heather gave some interesting numbers in regard to her situation. I had very similar analysis done in my litigation, but I want to stick with what I can tell you today and stick with a very simple analysis because, as I've said, I'm not an economist. One thing that prompted me to ask this question, well, let's begin with this. The medical expenses for my treatment have reached nearly $500,000. I've lost over 6 months of work time during my recoveries from treatments and hundreds of hours in medical examinations, consultations, tests, and follow-ups interrupting my workday. I estimate that the total value of my lost work time has exceeded $350,000. I can easily estimate, excuse me, I cannot easily estimate the opportunity costs, which constitute the lost value of what I might have accomplished with that lost work time. But I've already asserted here that the costs of my medical treatment and lost work time amount to something like $850,000 so far. And as I pointed out, that's a simple calculation, not an actuarial analysis involving the value of decreased working life expectancy or any other factors that one has to consider in order to arrive at a definitive estimate of the economic loss in a case like mine or Heather's. So we're keeping it simple here because I'm not an economist. By the time a patient with asbestos-related disease dies, though, medical expenses alone can approach $1 million. We know that from many cases. And much of that may not be covered by Medicare or other insurance. For every patient who obtains reimbursement of costs through insurance or litigation, there are others who do not. In addition, caregivers within families often must give up work time and sometimes their own jobs. Ultimately, some families are left destitute. Multi-generational impact is not uncommon. I knew a woman who died of mesothelioma, as did her father and grandfather, both of whom were workers in the same shipyard and whose work clothing brought home the asbestos that eventually killed this woman. Her family has suffered financial devastation into the future. It's said that each year at least 10,000 Americans die from asbestos-related diseases and that currently some 30,000 to 40,000 Americans have such diseases. Considering that many are diagnosed in their 50s or even younger, significant work years can be lost not only to death, but also to disability. The World Health Organization data suggests that every year, from occupational exposures alone, the U.S. loses on the order of $150,000 total disability-adjusted life years, and that is person years of potential life due to premature mortality, and actual person years of productive life due to asbestos disability. Clearly, the overall economic impact on American families is well into the billions of dollars per year. Let's turn to the viewpoint of business. Most people will immediately think of litigation costs associated with asbestos product liability. That's probably because certain parties have invested in creating that framing of the issue. How often have we heard mention of the more than 70 companies that have gone bankrupt due to asbestos litigation and how such bankruptcies have clogged the legal system? Well, not only were many of those companies very small with negligible impact on the nation's economy, but 70 bankruptcies over 3 decades is an average of about 2 per year, and that's a trivial number when compared with the 53,000 business bankruptcies filed in the United States every year on average over the same period. So if the bankruptcy courts are clogged, it's difficult to accept that this is because of asbestos litigation. We also have often heard the figure of $70 billion having been spent by corporations on asbestos litigation defense through 2002. We might think that's not a big percentage of what corporations spend on litigation defense in total. Still, this figure suggests that businesses fear for the costs of future defense of asbestos lawsuits. If they didn't, they certainly would not have spent so heavily in recent years on lobbying for passage of federal trust fund legislation to end such lawsuits. Some direct and indirect costs to businesses are incurred when companies must remove asbestos from buildings. This expense probably does not add a significant amount to overall costs of asbestos use in America at this point. However, the increasing incidence of asbestos abatement problems in the U.S. suggests that this issue is growing in significance. And this burden will continue far into the future because of the sheer number of residential, commercial, industrial, and government buildings affected. More importantly, businesses incur costs from decreased employee productivity and increased premiums for workers' compensation and medical insurance. These factors may adversely impact job creation within the operational segments of businesses. If every challenge also poses an opportunity, there is certainly one lurking for the business community here. Prohibiting asbestos-containing products would lead to the creation of productive jobs, excuse me, go back there, of productive jobs, thousands of products would have to be reformulated or replaced, and manufacturers and marketers eventually would be freed to divert investment from legal defense and regulatory compliance to growing their businesses, while fewer of their workers would be brought down by asbestos-related diseases. Instead, we tend to hear businesses say that having to eliminate asbestos would increase their costs. Back in my days as a manufacturing manager at Hewlett-Packard, we used to say that costs walk around on two legs. What we meant is that most of the costs of the business are those associated with headcount, salaries, payroll taxes, office space, cafeteria space, parking space, and everything else but the materials that come in through the receiving dock. But in the factories that produce those materials, the same thing is true. For example, asbestos is just a mineral. It has no value at all until it's extracted from the ground by people, at which point it becomes a commodity sold at a price to other people who add value to that material by incorporating it into their products, which in turn may become materials used in yet another factory. Costs walk around on two legs. So when a business manager says that his or her company's costs will go up because of some new regulation like a ban on asbestos, he or she is really saying that somewhere along that chain of adding people to a material, some jobs will be created. If we hear the manager say that costs will go up and jobs will be lost, that's just a complaint about the possible impact on that company's competitiveness. This is an easy and common complaint to make, but it ignores the potential role of the one supremely powerful force for reducing costs, which is innovation. Where there's a financial opportunity, people will invest to change the economics of the value chain. In the long run, companies in the chain will tend to become more efficient. They will cut costs and jobs, and life will go on. But it's an open question as to how the value in that chain will be redistributed among the companies. So it's about who gets richer and who doesn't. This would suggest that regulation in itself doesn't have to mean job loss or cost growth to the overall economy in the long run. Hidden in a regulatory change like banning asbestos is the opportunity to build an economic engine. There's an abundance of smart business people who will figure out how to create jobs in one place while cutting costs, and by that I mean eliminating jobs in other places. Banning asbestos will change the status quo for businesses, but it won't be the end of the world. In fact, it will create enormous new opportunities for business competition. So when you hear whining about rising costs and lost jobs, remember that the whining comes from people who just don't want to face that challenge. Now, to address the value of mitigating the public health risk, we must ultimately look at the problem from the governmental view. Federal and state governments pay for asbestos-related diseases in the form of medical care, disability, and other workers' benefits, not to mention the costs of regulatory enforcement and abatement in public buildings and some impact on judicial systems. Tracking these costs and benefits is an enormously complex exercise. For example, in connection with civil litigation by patients against asbestos product companies, Medicare is aggressive about asserting its own right to reimbursement for medical expenses, thereby shifting this financial burden from the government and taxpayers back to the defendants. Note that the government benefits from decreased life expectancy of victims of asbestos-related diseases, because those people are expected to lose some of their potential Social Security payments and other benefits, thereby producing a net savings for the government and its taxpayers. This sounds a bit like the apparent argument for keeping people smoking, doesn't it? On the other hand, affected workers may not contribute tax payments over a full working lifetime due to both disability and early death. So the government will see a corresponding loss of revenue from that factor. So here we see the other side of the story, that it's a good thing to keep people living and, one hopes, making an economic contribution. So let's put all this together. If we as a nation could prohibit the presence of asbestos in products in American commerce, and if we could couple this ban with more stringent controls and incentives for proper abatement, building demolition, and other ongoing sources of asbestos exposures, we might finally be able to foresee curtailment of future disabilities and deaths caused by asbestos. Over the long run, the federal government could witness a net economic gain from reduced benefits payments and operational costs, along with extended tax revenues from workers. Such an investment would lead to the creation of private sector jobs in the replacement of asbestos as a product ingredient, in eliminating asbestos as a product contaminant, and in abating in-place asbestos. Job expansion would include factory and field labor, engineering, marketing and sales, and most other business functions. This outcome would add to the taxable payroll overall. From the business standpoint, one has to wonder why there are no lobbyists pushing for the creation of such a new economic engine. Astute business people could begin by studying the results of the bans already enacted in so many other countries. One could imagine support for such a study coming from some equally astute legislators and a willing government agency, or maybe from private sources. Overall, these considerations suggest that an attractive business case might exist in favor of federal investment to prohibit asbestos-containing products, to support public awareness so as to mitigate personal exposures from existing products, and to provide effective incentives for regulatory compliance. I would assert that the economic impact of asbestos on families, businesses, and government is significant, that a ban on asbestos-containing products in America would create a significant number of new domestic private sector jobs, albeit with some early dislocation between companies, and that such a ban would be good for both business and governments in the long run. We deserve to see a comprehensive evaluation at the national level. Thank you.
But thanks for coming, and thanks for making this the most successful conference thus far.
Keep me in your heart